Hi, my name is Manoj. Krishna. I'm a spine surgeon. And today I want to tell you a story of a 66-year-old patient of mine who presented with 26 years of back pain. These patients are challenging because some surgeons think that surgery for these patients doesn't work because of the long duration of symptoms. Malcolm had a 2-level interbody fusion under my care because he had degenerative changes at L3-4 and L4-5. Here's the lateral X-ray, and you can see the screws and rods in the spine and also the cages in the disc space and the bone forming across the cages. The surgery is fairly straightforward and takes a couple of hours, and patients are in hospital a couple of days. Here's Malcolm telling his story. Morning, Malcolm.
Hello, Mr. Krishna.
How old are you, Malcolm?
66.
Okay. And tell me a story about your back problem and when it started.
Well, it was at least 26 years ago because although I'm divorced now, I found my late wife, or ex-wife's birthday card to me at 40 saying, with your knackered knees and your knackered back. So that was 26 years ago. I just had an ache, and never chronic, but always there. And in the last year or so, it was getting that I couldn't stand up without having to sit down after about 5 or 10 minutes. If I went walking, I had to sit down after 10 or 15 minutes. And it recovered very quickly, but it was affecting my quality of life. I'm a golfer, and to play golf I had to take painkillers, and I'd been told I'd had all the things you can have: injections, physiotherapy, traction, acupuncture. I'd seen a surgeon who told me that it was hard luck, that I'd got a warm back and I'd just got to live with it. And a friend of mine recommended that I come and see you.
And she'd had surgery herself?
She'd had surgery with you. Hers was much more chronic than mine, but she said it was a life-changing experience, and I'm sure that after 3 months all the indications are that I'm going to have the same experience.
Okay, so
myself.
let's talk about it. So you had surgery about 4 months ago?
3 months.
3 months ago. So
yeah.
tell me about your experience of the surgery and how you recovered and so on.
Well, I've got a skeletal problem. I'd had a knee replaced 3 years ago, a hip replaced a year ago. So in the sense of having any concerns, I didn't have any, but I had no experience of what it would be like after the operation. And when I was first asked the next day to get out of bed, I was rather apprehensive, expecting that the minute my feet touched the ground I'd be in discomfort and pain. I wasn't. I went for a walk along the corridor the day after the operation, and the nurse said, you might as well go up the stairs now because you're moving so well. So I was completely mobile. I can't say people treat pain differently. I was obviously aware that I'd had surgery, but the pain management was fantastic. So I just don't feel that I had any real major discomfort after it. I did have a minor leak, so they kept me in 5 days instead of 3 days. That cleared itself up within a couple of days, and the clips were out on schedule, and I've been recovering and feeling marvellous ever since.
So you're now 3 months from surgery. So
yes.
Tell me how you're getting on. How much pain do you have?
I have an awareness. I wouldn't call it pain. I haven't taken any painkillers for at least 5 or 6 weeks. The main awareness still is if I'm inactive. So particularly waking up in the morning after bed, I'm a little stiff when I get out of bed. If I sit and watch TV without getting up for an hour or so, I'll be a little stiff. But 6 weeks after the surgery, I drove 3¼ hours down to Suffolk, and I didn't have any stiffness when I got out of the car.
And your pre-op problems have gone. You can stand now.
Yes, I can stand now, and it was as recently as January. I was in London before the operation, and I had all these symptoms, not being able to stand and walk very far. I went down in May, about 6 weeks after the operation, and was able to do those things. And I've been down again to Wimbledon, and
okay.
I was walking all around Wimbledon and standing, walking, and all those symptoms have completely gone.
I think. Thank you very much, Malcolm.
It's a pleasure.